Hi, this is Dr. Cooley, and the next thing we're going to work on is different hanging exercises. I like to tell people you could, from a corrective exercise standpoint, you can fix most things by doing squats, crawls, and hangs. And one of the reasons why hanging is so important, if you really think about it, there's people, they could go months without really lifting their arm over their head. But when I'm treating patients, I probably have to treat stuff in the shoulder blade area more than any other area on their body. And I think part of that is due to the fact that people don't lift their arms over their head very often. This is another essential human movement. If you watch a toddler, they can hang really, really well. Like, they can hang and do leg lifts much easier than, like, I can't ask my 7-year-old to do a pull-up, but she can hang really, really well. So again, these are fundamental exercises, or fundamental things that you kind of come out of the womb programmed to do, but over time we've gotten worse at it. And I've noticed this myself. I used to have a hard time hanging. I could do 10 to 15 pull-ups, but if I went to go do monkey bars at the playground or something, I would actually have a hard time doing it from a straight arm position. I could do it if I stayed in this chin-up position, but it's helped me out a lot as far as making my pull-ups stronger, and it's something that everyone should really try to work on, especially if they could do it every day. It would help out a lot. It would eliminate frozen shoulder as an issue. So the first thing we're going to start off with is just a passive hang. So all I'm going to do is grab onto the bar and just hang out here. And I even want to try to sink down. That might be painful for people to do at first, and if that's the case, they're going to want to go into a active hang, which is basically you still have straight arms, but your shoulder blade is more engaged. So I'm basically taking my arm and I'm kind of pulling it in this direction. So here's a passive hang, and now here's an active hang. Some people's connective tissue just might not be ready to really let go and really hang out there. They need to actually start with the active hang first before they can progress to the passive hang. But it's good to actually do both of those and really try to focus on, when you're going from passive to active, like keeping that arm nice and straight and just focusing on shoulder blade movement. This last hang that I'm going to show is called a scapular retraction hang. So it's this, when I bring my shoulder blade back like that, that's retraction, and that's what I'm going to try to do as I'm hanging on the bar here. So I'm going to start off in a passive hang, go to an active hang, and then I'm going to pull back. And that's a really good way to strengthen up the lats. Just get more control over your shoulder blades, and it will help you on your pull-ups. You'll be able to get further, you'll be able to pull yourself up higher, as opposed to doing a chin up to here. You'll be able to kind of get those elbows down.